have information on how to request and receive CEUs. We would have a link to our GIPRA. Please fill out our GIPRA surveys. Our GIPRA helps us know what you enjoyed about trainings and how we can do better. Thank you. And so this is a land acknowledgement that was developed and prepared by members of our team, Ella and Keely Driscoll, who are sisters from Meskwaki and Winnebago Nations, and our co-director, Sean Bear, who is from Meskwaki Nation. Please take some time to read out this land acknowledgement. Thank you. And as we continue to pay respect and honor the lands and the peoples of the nations and everywhere we stay, if you're not able to finish reading this land acknowledgement, we have it on our website. You could also reach out to me for the land acknowledgement. Next slide, please. And so today we will be listening and learning from Justine. I'm very excited about this webinar. Justine has dedicated her career to assisting organizations harness the power of service, has been working to strengthen capacity in various communities, and she has facilitated various trainings and programs for tribes, nonprofits, governments, and all over internationally and nationally. And I'll hand over to Justine to properly introduce themselves and go on the training. Thank you.
Thank you, Cindy. And thank you, Shirley, for the wonderful blessings and the wonderful start to this webinar. I'm absolutely delighted to be joining you today and offering what I have learned and know and believe about resiliency and about the many pathways to resiliency. And one of those pathways is sustainability. And certainly all of you are understanding what it means to be a resilient individual, a resilient organization, in this time particularly of such great unknown and disruption. And yet we continue on. So I'm delighted to be with you. I've spent most of my career working with organizations and individuals as they work amongst themselves to solve problems within their communities. So this today is but the first of, as Cindy said, of a 4-part series. We're looking particularly at the pathway of sustainability. And just a reminder in terms of how I describe and how I think about sustainability, I think about it, oh yes, 1 or 2 questions, good. Thanks. We have a poll up. So if you would tell us 1 or 2 questions, one or two things about the primary focus area that you have, and your work, that will give us a sense of who we are. Thanks, Cindy. I just moved right in. That's great. So, right, most of us at this point are working in prevention, and some in mental health, and then there's others in another one. Most are working with youth. Oh, good. We can share those results. Hope that's not mine. So you'll see that many of us, 75%, are working in the area of prevention, and then we have also mental health and counseling, and then some other organizations. And again, 75% are working in the youth and 38% with adults. Great. All right. So that gives us a sense of who's joining us today. And again, thank you, Cindy, for putting up that poll. So we're going to talk about sustainability. And what I mean, what I think about when I think about sustainability is it's the ability to continue to meet the needs of the people that you're serving, or that's served by the project, with resilience beyond the life of any specific grant you have, or with diminishing support. So we're going to be looking at how to continue the work that you feel is important and that you know is important within your communities, regardless of the funding that you have and regardless of the project. Okay, are we okay? I hear some noise in the background. Are you all, can you all hear me all right? Just raise your hands if you can. Okay, super. So the framework that I use and that we're going to be using over the next 4 series is there's 4 pillars of sustainability. One is internal support, another is resources, another is partnerships, and another is marketing and outreach. Think of it as a 4-legged table. You know, you've all sat at tables where one leg is a little shorter than the other and it kind of tips and it's tippy and it doesn't quite work. That's how we think about sustainability in terms of each of these pillars are important. This is the foundation, however, of those, the foundation of those pillars is a strong evidence-based program that you are all involved in. If you wouldn't mind, it would be great if you would mute yourself until you're ready to ask a question. That would help. That's great. Thanks. So what we're looking at today is that strong evidence-based program. We're going to start out with, how do you build your case for support? Because none of those pillars will be able to hold themselves up if you're not able to talk about and develop and present your case for support. So that's what we're looking at during this 90 minutes that we're together. Our goals are, by the end of this time, you'll have a sense and bring up the scope and purpose of the work that you do, the appropriate data that you have that you talk about within your report, and then we'll begin. I know you all have an elevator speech. We'll begin to look at that and end with that as we go forward. So that's how we're setting it up for today. What I want to do first is start with what it is that you as individuals do, because we always build our case for support from the inside out. We start with who we are and what we do and what we believe in and what we're excited about. And that's really the foundation of our case for support. And then we're able to add on to that with other information. But we're going to start now with what it is that you do. And we're going to do one of my most favorite things, which is called appreciative inquiry. You have a handout related to this. It's handout number 1. And Cindy just put that in the chat as well, in case you didn't get it. I think the handouts were sent out with the reminder today, but in case you didn't get it, Shirley or Cindy just put it in the chat section so that you can pull that up. This is the first handout, and this handout includes some information for you around appreciative inquiry, what it comes from, how it is, and all of that. Don't worry about using that right now. What we're going to do, first of all, is just look at the main points of it, and you can have this for if you want to do further reading and thinking about it, and or use it yourself with your staff or with some of the people that you work with every day. What I like to think about is that with this process, we focus on the root causes of success, not the root causes of failure. And that comes, we focus there because what you look for is what you get. And you've all had that experience, right? If we're looking for problems within what's going on, that's what we're going to find. If we look for success in terms of what's going on, we're going to find that. I love this one. Where you think you're going is where you end up. You know, when I get up and I think, oh, well, I'm going to go make coffee, just as simple as that, that's where I end up. If I wake up and think, oh my goodness, I don't know what I'm going to do today, I end up pretty much in a state of confusion. There are three principles to this, three problems, right? How easily we go there. There are three principles to this thinking. And that is, if you look for problems, you find more problems. If you look for success, you find more success. And if you have faith in your visions, you can accomplish your goals. I always think about, I was a high school reading teacher at one point in my life, and I got to teach summer school reading. And I know you all know that the last thing any 15, 16-year-old boy wants to do in the summer is go attend summer school and reading. But I had this one student who came because he so badly wanted to just check it off that he got it. And his name was Bill. And he said, but I don't read. But every day he would bring a magazine with him that was all about auto sports and cars and mechanics and all of that. And he would spend all period looking at that. But he always said to me, I don't read. One day I stopped by his desk and said, tell me about this. Tell me about this article. And he went on and on and on, clearly stuff that I didn't understand. But he went on and on and on. And I said, Billy, you just read that. He said, I don't read. I don't read Shakespeare. I don't read all of that kind of stuff. But cars, yeah, is that reading? And I said, that's reading. Bring your magazines. Bring anything you want. You are a reader. Not that it was any great miraculous change, but as he left that class, he said, you know, I think I might branch out. Instead of just reading about cars, I think I might read about football. I said, I think that's a great idea. Why don't you try basketball? Yeah, I think I'll try basketball. Do you think my teacher will like us, would like a paper on basketball? And I said, try it. Just try it. So again, the point is you get what you love. As somebody just said, read what you love and you will love to read. Absolutely. You go for the success. So now I'm going to give you a chance to, if you'll go to your handout on page 3. Yeah. What we're going to do is we're going to divide up into pairs, and you will interview one another in terms of these questions. But the first question is around, this is about following your passion. So what I want you to do is think about your experience in your work, in your project, in your program, what you're currently doing. Remember a high point or a time when you felt totally inspired, engaged, and hopeful. Tell your partner a story about that time. And if you're the listener, feel free to ask questions like, what was happening? Who else was involved? What was your role? What did you do? Encourage the person that's telling the story to fill it out even more. And then when you finish that, then go to the next question. And this is about making a difference and bringing hope. And on this part, I want you to reflect upon the project or the program that you as you know it, and think about what it has contributed to your community. Tell a story about the single greatest contribution that you think your project or program has made. What was it? Who was involved? What was the impact? What was the change? What was the difference that was made? So here's what's going to happen. You've got those questions on page 3, so don't worry about whether you've got it all down yet. You're going to be in partners, and you'll each have about 5 minutes. So decide when you first get together who's going to tell their stories first and who's going to be listening. And if you're listening, be sure and listen and ask some more questions about it take some notes if you want, because when we come back, then we're going to just enter the themes in the chat room. And then we'll give you notice about halfway through, and then you'll be able to switch, so that if you were the one telling your story, then you'll be the one interviewing and the other person will tell the story. Any questions about that? All right, great. Have a super time. So Cindy, is everybody back?
Yes, I think we have everyone back.
Okay, good. Well, sorry for the technical glitches. I understand that there were some along the way, and then also that people were not able to participate. Sorry, and I have a dog barking who is saying, I want to participate, right? Sorry about that. The joys of working from home, right? Oh golly, don't we wish that we could all be in the room together? But I'm glad that we're here. And just if you were able to interview somebody and hear the story, that's great. If you weren't able to interview and hear a story, just tell me a little bit in the chat in terms of what were some of the themes that came up? What were some of the ways in which people were having an impact? What moved you about this story? Oh, the passion for prevention, absolutely. Creativity with 6th graders. Relationships with community members. Sorry that you weren't able to connect. People helping people. Suicide prevention. Engaging youth and adults. Recovery. Oh, the passion of our youth becoming young leaders. Isn't it fun when you see somebody become a leader? It's so exciting. I can just feel the energy that people have with this. Building awareness, wraparound. Absolutely, not one thing, it's a wraparound. Intergenerational healing, tribal efficacy. Oh, the little bits of hope. Absolutely, the little bits of hope, a step at a time. Yes, their work continued. Yep, in spite of the difficulties with the coronavirus. Gaining trust. Yeah, within the community. Absolutely. Oh, I'm so pleased. I can feel the energy of excitement and of passion. And I hope too that you enjoyed the networking. Yes, we share the love we share for the work we do. That's exactly where I was going. I hope you enjoy the networking and being able to talk with one another. Maybe you hadn't met people before, these same people. Hope you got the emails and that you will be able to continue working with them. Yeah, wow. 20 families. Wow. Yeah, great, great. Well, we're going to use this, and do continue to put your thoughts into the chat. So we're going to continue to use this energy as we move along into the other aspects of building your case for support. And this then, if you would pull up handout number 2, those are the questions that we're going to be looking at next. So in handout number 2, you have the first question, what you were hired to do. Like you've talked about that for the last 10 minutes with a pair or with your partner, or and just with yourself if you weren't able to connect with anybody. Now we're going to look at those questions under number 2. What's the community issue that you are the solution to? So we're starting building your case for support. And now we're taking it with the energy that we've just built. within you and building from the inside out. Now we're looking at it from a more, oh, how do I want to say it? From a different point of view, from a more outside point of view. So you need to be able to talk about as you build your case for support, you want to be able to talk about the community issue that you're addressing. You probably already know that. You talked about that in terms of suicide prevention. You talked about it in prevention. You talked about it in working with young mothers. And now you want to be able to get more specific in terms of what this grant is really addressing. So I've just given a couple of examples. Believe me, you will have your own. But for one, youth in the community are impacted by the current opioid crisis, have been removed from their homes, and are traumatized by the separation and isolation. That's a description of a community problem that that somebody in their project is taking on. Or the lives of our tribal youth have been victimized by the opioid crisis, and there's a gap in services provided to these young victims. Yeah, I'm just reading this question in the chat. That only shows us your screen with option to save to your system. Is there another way to put it in the chat? Oh, got it. That Cindy's taking care of that. Sorry, I got, thanks, Cindy. So that, all right, let's go back. So the community issue you're addressing. Now, where will you find this? If you don't have it already, a description of it, you would most likely go back to your grant application or to your project design or somewhere where it talks about some document that talks about the program that you're involved in. Believe me, I understand that you may not have been there when this grant was written. You might not have even been the writer of the grant. You might have no idea what is said in that grant. It is a good time to go back and see what it is that they're talking about so that you can begin with where you are now talking about the issue that you are addressing. Once you get the issue down, then you want to look at what's the national picture. When you're presenting your case for support, you want to be able, you're pulling others in to your story, if you will. And part of that pulling into your story is the national picture. For example, and I've just given some examples here, the AIAN experience, the AIANs experience opioid addiction at a higher rate than other populations. Misuse of opioids contributes to the challenges and sometimes failure in school and work. All of these, I know, make sense to you. You want to have them as part of the picture that you're going to present in your story. Then you come down to the next one. What's the local picture? How are you affected locally? And this begins to get at, why should I care? You want to, as you build your case for support, you want to encourage me, you want to bring me into your story that I care as much as you do. And again, this is going to be local, and these are just examples. But the former Attorney General Todd Hembry talked about, we've lost almost a generation of Cherokee children, and that the Native American children that have been removed from their families, 1,700 Cherokee children are in custody of both tribal members and state. A minimum of 40% of them are a direct result of opioid use. Here are some other examples of why I should care, coming down to the local feeling. Yeah, it's a traumatizing experience, especially for younger children who cannot fully grasp the circumstances. Number of children who experience separation. Again, I'm talking about it from the case that I've developed, so it's just examples. Your examples and your information will be different. This one, when you're talking about a tribe where the entire population is 800 people, the overdose deaths of 20 people in 1 year is not just a public health crisis. It has ramifications for our very existence. So these are the kinds of things that you want to find out in terms of your local picture. And where would you find these? I know you're going to help one another with this as well, but I'll just make a couple of suggestions. One is you'll find them, perhaps some of them, in your grant application. Some of them you'll find in already written up documents about your program or your project. Some of them you may go to the Indian Health Services in your area, or there are tribal organizations. Like one that I found online is the Rocky Mountain Tribal Leaders Council, who has a great strategic plan dealing with the opioid crisis, and they've got data on Montana, Wyoming, and Idaho. So kind of search around. You can go online, search around for some of these organizations who've been really busy gathering the data, because they're presenting it as well. And they're presenting it in the name of your tribe and around your tribe or around your community. Others, the state child welfare, they're collecting data. Go to them and see what kind of data they have about your community. There's the tribal epidemiology centers around the country. So it's seeking it out and finding the information that relates to the issues that you're dealing with and the ramifications, the impact that it has on you locally. So that when you tell the story, you've got me. I care about that because you're giving me information that helps me buy into your story. Then that gets to the consequences, why I should care. And the third question is, what's the purpose of your grant? What is it that you actually do? And you're going to find this in your grant as well, the overall goal. And again, this is an example, but the overall goal is to improve the lives of children and youth who've been victims of the opioid crisis, educate the community about issues and consequences. Think of it as a sample, as an example, but you're going to find your own. And then I've gone ahead and said, and the unique solution. So that's our problem. And now here's how we're addressing that problem. We have a three-pronged strategy. We provide direct service, we do widespread education, and we strengthen community partnerships. So this is how you're addressing those different areas. This is where your unique solution and your story. So that's handout number 2. And what I'd like to do now, hopefully we'll have better luck with our groups this time. But what I'd like you to do is we'll be in groups of 5 or 6. And I'd like you to discuss with one another, of these 3 questions, which of them can you answer pretty easily? And they're right there for you. You've got the information, you've got the data. It kind of just flows right out of your mouth. It's a story that you can put together. Which are more difficult for you to answer today? And help one another, particularly on the difficult ones. Where might you get that information? Or if that's been an easy one for you, where did you get the information that helped you answer that question? Any questions about that? All right, Cindy, let's try groupings, and we're going to be in groups of 5 this time. And I'm having trouble doing that. There we go. I think it's working now, right?
Yeah, we're good.
Yeah, okay. Let me just get my chat section back up. Okay. Sorry, this is the difficulties with technology. Goodness sakes, here we go. Okay, now I think we're back. So First of all, thank you for the feedback that there wasn't enough time in those groups, and that also they got cut off very shortly. I think some of us were cut off in mid-sentence, so I do apologize for that. It was a start, however, and the conversations that I was a part of were certainly into and beginning to delve into the questions that we need to answer. Sorry, here we go. The questions that we need to answer as we're beginning to put together our case for support, if you will. So just were there any that were easier to answer than others? Were there some that you found typically hard to answer? Do you have this data pretty much on your minds? Can you just put some comments in chat so we can see where everybody is with all of that? Okay, good. Thank you.
So I try to be prepared and for the questions that need to be answered, make it short and sweet, and try to give everybody else a chance, not really elaborate until we have time at the end of the group.
Great. Okay, well, we're all learning about all of this. And so this is the kind of thing, let's go to one more point in terms of as you are developing your case for support. One other important piece is the data, your program track record. Not only what you've done, but because we've talked about that some, but what's been successful and how many people do you serve and what differences have you made? Yeah, exactly. I'm going back to the chat as well. It's easier to answer about what I do than to get the more outside questions in terms of what is it that we do as a team. I know that you all are keeping track of what you do and you are gathering data, but it was requested that we talk about some of the simple ways to do this so that you have it in front of you. So I'm going back to my example, the one that I turned up. The other thing that I want to just also say before we get into this is that it came up in the group that I was privileged to listen in on, and the difficulty of continuing to do the particularly prevention outreach work in the days of COVID. And so plans that were made maybe even a year ago, and ideas for collaborations, ideas for community visits, ideas for in-person trainings. None of those things have been able to happen because we've needed to come back to our desks and think about other ways of doing that outreach. And those don't always work in the communities with which we live and work. I totally understand. And I know everybody on this call understands how difficult that is. And recognizing that, we also want to think about what it is that you have done and what you have been able to do. So I just want to do again an example based on the sample program that I've just outlined very briefly. But our goal was to increase awareness of youth victimization from the opioid crisis. And we were going to have this outreach. Remember, we had an education prong. So within that education prong, we have developed culturally relevant awareness and educational materials and disseminate materials to organizations and individuals with access to children, youth, or families. This I've just developed, and I know you have probably ad infinitum ways in which you're keeping track of the data that you have. sometimes it's helpful to just think of the very basic kinds of data that you would like to collect and that anybody working on your project can collect. So this is handout number 3, and I'll just pull this up and share it. I hope that's going to work. I'll put it over the slides. Can you all see that? Again, a very simple, straightforward way of anybody keeping track of what's happening. So you were going to develop materials. Here are the materials you might develop. You might have a brochure, you might have article for the elders, you might have a video, you might even have a TikTok or a Facebook page or a PSA for television. Those you just keep track of, that yes, you have those and they've been reviewed and they're complete. And then as all of you go about disseminating those, and even if you're disseminating them virtually, you're going to want to keep track of, yes, we sent them out. We sent the brochures to the elders, but then you might want to follow up in relation to, okay, did they open it? Did they see it? Those kinds of things. But that would be another one in which you would do it. So again, material distribution, elders, treatment facilities, first responders, schools, churches, wherever it is that you're wanting to get your information out, you keep track of the fact that you've done it, and then you come back in a third time and say, okay, did they open it? Okay, did they read it? Okay, can we have a conversation about it? Those kinds of things. What I'm wanting to do is have you look at the information that you are collecting. Is it helpful? Is it what you need? Is it allowing you to tell the story that you want to tell? And in relation to that, are there things that you're not collecting, particularly given how you've had to change the work that you've been doing? Are there ways that you're not collecting information that you can just set up a really simple checklist that whoever is working on that desk that day can be involved with? So there, we've kind of run the gamut now, and I know we're coming up to the close of our time for this one today. So what I want you to think about is going back to where we started, the passion that you have and the difference that you know you've made in your communities. And then we're coming back around to thinking about, okay, we've got all of this information out there in terms of our program. Reflect just a couple of minutes on the 1 or 2 sentences that you would like to include in like an elevator pitch or a description of what you want to say about your program. I know we don't have much time, but what do you think, Cindy? Do you think it would be good to go back into those groups? They could pick up where they were and or do this.
Yes, we could do that. How many minutes would you want us to? 10 minutes? Okay.
We have about 10 minutes.
Yeah. Okay. Great.
So we'll go back to the same groups we were in before. And think about, you can continue the conversation. You can think about data, or you can begin to think about and try out with one another the 1 or 2 sentences that you have for your elevator pitch about your program. How do you describe your program?
Excuse me.
Yes.
So I think some of the people may not have a system for developing or collecting their data. So think about that too, if you need help with developing a system to collect your data, because when I worked with the TOR group the last 1.5 years, that's one of the things one of the grantees brought up was they did not have their own system for collecting their data, because it's different from GIPRA. GIPRA is so like, it's a lot, it's big and it's government run, but do the tribal folks have their own system, and do they want to develop something that's very simple too?
That's great, Shirley, and bring it up in the group and also give it to us in the chat too, so we have that information. Thank you very much for bringing that up. Okay, I see some people are needing to leave, and I understand that. So let's go back to those groups that we had before. We'll have 8 to 10 minutes, and then we'll come back and close it up.
All right. Some folks might just be moved to new groups just because other members of the group have left, but not a lot of people. So.
Okay. So, gosh, oh my goodness, we're nearly to the end of our time.
Cindy.
Yes, please, Shelley.
Can I sing a song?
Oh, please.
Please, thank you.
Yes. Okay. This song, it's I call it the Negani song, and it's a song that Ojibwe people, some Anishinaabe people sing it, and it talks about tobacco and leading with the tobacco in a good way, and it was given to people to help them to heal and to walk in a really good way.
Oh, thank you so much, Shirley, and thank you everyone for joining us today. What I'm hoping you're taking away is that you tailor your case to the facts, you find national data, you build in local information, you tell your story because you know your story best, and each of you are bringing hope to your community and definitely to me as we share this time together. So we'll see you in a month, and I can't wait. Please do fill out the evaluation, and we'll do next time. Megwich, thank you. Miigwech, thanks.
Miigwech.
Miigwech.
Nagad.